Yeah, so it's really important to think about a multidisciplinary approach to care for people with Rett syndrome because it's a complex disorder and they have a number of problems. So, oftentimes we generally need to have therapists that would be like speech therapists, but specifically people who are versed in alternative and augmentative communication, since people with Rett syndrome can't speak and they can't really use their hands, but they can develop ability to communicate using eye gaze or other nonverbal methods. Furthermore, they need things like physical therapy and occupational therapy to improve their hand function or gait or standing. But beyond that, in terms of the medical specialties, nutrition and growth is always a problem in Rett syndrome, chewing and swallowing. So it's really important to have a gastroenterologist. Many people might need to have gastrostomy tubes placed, so having pediatric surgeon. Things like orthopedic surgery, there are a number of issues like scoliosis and positional deformities. It's helpful to have people who are like physical medicine and rehabilitation or physiatrists who can help coordinate the care with the therapist and also provide other types of interventions such as Botox or baclofen to reduce spasticity and rigidity. Beyond that, it's, you start thinking about things like seizures and of course a neurologist, but sometimes it's severe and might need a neurologist that has specialty in epilepsy care. And then, there are other issues that can arise, such as issues with lung function, although people with Rett syndrome have breathing abnormalities that are typically due to control of the breathing rate, but they can have recurrent aspiration pneumonias and they can have diminished lung function. So having somebody on board who's a pulmonologist with experience in Rett syndrome is also helpful.